Hey everyone, it's Dr. Alessandro. Welcome back to my channel. And in this video, I'm going to be answering the question, hey doc, what are immediate dentures? So this continues with the denture series. Now, immediate dentures are done in a scenario where a patient may have still a bunch of his or her remaining teeth. So picture having a lot of these teeth, not all of them, but at least enough that when they bite down, when they close down, we as dentists, and well, of course, the patient themselves, can close down in a spot or in spots that are repeatable. That is, you can close down in a stable manner somewhat, at the best possible, but where maybe in a certain sense, you don't have to guess where that closing spot is. So a person has an area where they do close and chew reliably. So what happens is this: we as dentists will take molds of the upper and lower teeth. We will also get a registration of the bite to see where everything closes together. And we send all that information along with shade, of course, whatever shade of teeth that the patient wants, to a laboratory. The lab will then send back the denture or dentures in this case. And so the lab will send it back, and the day that we are to deliver the immediate dentures, when that day comes, we extract all the teeth, and if that's what the patient's plan is, and then we deliver, or we give the patient their dentures. Now, what are the advantages? The advantages are that at least we know, relatively speaking, where the bite is, so there's really not much guesswork with that. So the patient has a stable bite reference point and can chew pretty much normally as best possible with dentures, and that the patient gets the dentures right away. That is, there is no waiting a whole bunch of different appointments to receive the dentures. The dentures are right there, right then, and they go home with that person on the same day of the extractions. What are the downsides? There are a couple. First of all, these dentures over time will probably require more adjustment because the bone on the jaws will shrink away from where it used to be. The tissues will shrink. So that will cause the dentures, upper and lower, to get loose. So more adjustments will be necessary, and relines are going to be necessary. A reline is something that I'll explain in another video, but basically it's to kind of recapture the new tissue form and new bone form, as it were, to make things fit better. So there are some disadvantages to doing immediate dentures, but the big advantage is that the patient, whoever it is, him or her, gets their dentures right away instead of having to go through a sequence of visits to end up with dentures at the end point. So that is the basic plan for an immediate denture, if you were asking. Thank you so much for joining me, and hope you have a wonderful rest of the day and you're staying well and healthy.